Let's talk about biotin. A lot of people are taking biotin for hair, skin, and nails. By the way, does biotin really work for hair, skin, and nails? Check out my other video that I did on it. I'm not trying to be coy. I'm just saying that's not the focus of this video, but you might be wondering if it works. So check out my other video on it. I will link it here. But this is the thing. Biotin is B7, and for most people, it's probably going to be fine to take. I'm not here to be an alarmist, but I need to let you know about a potential danger of taking biotin and how to get around that, okay? So biotin is B7, and there may be many reasons why you are taking it. You also might be taking it and not know that you are, or not be doing it intentionally. What do I mean by that? Biotin can be found in multivitamins, so you may be taking a multivitamin and it just has that in it. You might be taking, like, say, a hair, skin, and nails type of supplement, and biotin might be in that. You might be taking a supplement for, like, B complex vitamin supplement, and it might be in that as well, right? So it can come in different ways, not just taking biotin by itself, which some of you also might be doing. This is the danger, guys, okay? The potential danger. Biotin can actually interfere with a number of really important lab tests, to the point where it can actually cause misdiagnosis or missed diagnosis. What do I mean by this? Biotin has been known to either falsely lower or falsely elevate certain important labs, like troponins. What is troponins? Well, troponin is a lab test that we often use to diagnose heart attacks and things like that. You want a troponin test to be accurate because it's testing for something really, really super important. Biotin can actually interfere with a troponin lab and falsely lower the troponin, meaning make the troponin number seem lower than it actually is, which can cause a misdiagnosis of, say, a heart condition, for example. There are actually case studies of this, by the way, and the FDA did actually put out a warning about how biotin can interfere with troponin, as an example. You can Google that so you can see for yourself. But it's not just that. Biotin can actually interfere with thyroid tests, which means that if your doctor were to order a thyroid test, it could look like you have a thyroid problem and you actually don't, if you are taking biotin, potentially, right? Of course, the interference, the problem is not going to happen with everyone taking biotin, but it happens in enough people that there is literature out there about this. There are case studies out there. There have been FDA warnings about biotin and how it can interfere with lab tests. Other lab tests that biotin can interfere with, it can interfere with other hormones. Things like, I mentioned thyroid tests, cortisol levels, vitamin D potentially, FSH, LH, it has to do with like estrogen and that type of stuff, okay? Parathyroid hormone, there's probably others as well. But this is really important because, you may say, well, what's really the big deal? As I mentioned in the case of troponin, it could potentially cause a doctor to not be able to assess whether someone's potentially having a heart problem or not appropriately because the lab seems different than what it actually is, okay? But when it comes to your hormone levels, that can make a big difference, right? If we are getting lab numbers that we can't trust because biotin may be interfering with them, we may send you down a whole, a whole goose chase full of testing and stuff like that that's unnecessary, causes stress, or may actually be harmful in terms of what we're doing to try to understand what's going on. So what am I trying to say here? Am I saying don't take biotin? No, that's not what I'm saying, okay? That's not what I'm saying. What I'm saying is this, and this is where the warning is because of this potential danger and the potential for biotin to interact with lab tests. What you need to do is, if you are taking biotin for hair, skin, and nails, B complex vitamins, biotin by itself, multivitamin, you got to let your doctor know what you're taking, which supplements, and in particular biotin. I would say all of them. The reason why is because when we get your lab tests back, if there's abnormalities, we may need to take that into consideration. Either have you stop the supplement before getting your labs, do other things, okay, or reevaluate your lab work in this new context of information that we have. Really, this is a big deal. I actually have had patients that this has happened to. I've actually had friends that this has happened to, where their biotin supplement ended up being the culprit for abnormal labs that they had. Okay, so this is a big deal. So again, not that you can't take biotin, it's that you need to let us know what you're taking, and also understand this is why supplements and vitamins really need to be thought out, okay? Because they can interfere with labs, they can interfere with other supplements and vitamins, they can actually interfere with some medications you're taking. Check out some of my other videos I've done about some just things you need to be thoughtful about with vitamins and supplements. And again, if you want to learn more about how biotin plays a role with hair, skin, and nails, check out my video on that. I will link it here. If you don't see it, just DM me for it. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. Please like and follow my page on YouTube. Please subscribe to my channel. Click the little bell for updates. I'm on TikTok and WhatsApp and other channels at Dr. Jen Caudle, and go to my website, www.drjencaudle.com, to sign up for my free health newsletter. All right, guys, hope you're doing well. Bye.